Hey people, it's Niall Stokey. This is a story from the Daily Mail. Pregnant women who get a vaccine pass on virus, a COVID vaccine, pass on virus fighting antibodies to their babies while in the womb, study claims. A study has found pregnant women pass on COVID antibodies. New York University researchers studied 36 women who had mRNA vaccines. All the babies had antibodies protecting them from coronavirus. Pregnant women who have had a COVID vaccine pass on their protection to their unborn babies, a study has suggested. Researchers from New York University took blood samples from 36 babies delivered by mothers given either the Pfizer or Moderna vaccine. Results showed they all had corona-fighting antibodies. Mothers in the second half of their pregnancy had the highest antibody levels in the blood in their umbilical cord, the study found. Experts said the results weren't surprising because it happens with other jabs, but they insist that findings prove vaccines have the power to protect two lives at once by preventing severe illness in both mothers and babies. Dr. Ashley Roman, an obstetrician at NYU, said, and one of the lead authors said, if babies can be born with antibodies, it may protect them in the first month of their lives when they are most vulnerable. Children face a tiny risk of falling seriously ill with COVID, a plethora of studies have shown since the pandemic began, but the risk is slightly higher among babies who have weak immune systems. But data from Public Health England PHE shows pregnant women in Britain are still hesitant to receive a jab, with just 10% coming forward for an appointment by the end of July, the most recent data is available for. This is despite women having been eligible for the vaccine at the same time as the rest of their age group since April. The numbers are slightly higher in the US, where 23% of pregnant mothers are vaccinated, according to the Centers for Disease Control and Protection. All studies so far have suggested mRNA vaccines such as Pfizer and Moderna are safe for pregnant women, with no proof behind claims they cause stillbirths or defects. I'm going to have to take up issue with this because one thing I've often said is that what they'll do is they'll just simply write off any death as something else. It's very easy to prove something is safe when you dismiss all evidence to the contrary. The latest NYU research was published in the American Journal of Obstetrics and Gynecology, Maternal Fetal Medicine. Despite the low sample size, it is encouraging neonatal antibody levels are high if women are vaccinated, according to lead author Dr. Jennifer Leiter. She said high levels of transplacental antibody transfer aren't surprising. It is consistent with what we see with other immunizations. Our findings add to a growing list of important reasons why women should be advised to receive the COVID vaccine during pregnancy for the added benefit of their newborn receiving crucial protection. It comes amid a concerted push by health chiefs to encourage pregnant women to come forward with a jab. Severe illness due to COVID is uncommon in pregnant women, but is more likely in the third trimester. Pregnant women who do fall ill with the virus are 2 to 3 times more likely to give birth to their baby prematurely, some studies have shown. Women in the UK are advised to get Pfizer and Moderna vaccines because these vaccines have been given to over 130,000 pregnant women in the US, and they have not raised any safety concerns. Dr. Mary Ramsey, head of immunization at PHE, said it's encouraging thousands of pregnant women have received the COVID vaccine. We strongly urge anyone who has not yet taken up the offer to get both doses as soon as possible, and for pregnant women to come forward for the second dose 8 weeks after the first dose. Dr. Edward Morris, president of the Royal College of Obstetricians and Gynecologists, said, we're encouraged to see more than 50,000 pregnant women have received 1 dose of a COVID vaccine. We recommend vaccination in pregnancy as its most effective way of protecting women and their babies from severe illness and premature birth. We are concerned that increasing rates of COVID infection will adversely impact pregnant women. I don't understand. There's so many people that have been vaccinated, at least the 1 shot. So how is it spreading? I thought they told people that once they did, it would stop, supposedly. Let's keep going. That's just... I'll leave that in this article description. You can read the rest. It's not as important. So anyway, please comment, rate, share, and subscribe. I'm going to leave this article in the description. Peace.